So how long have you had this pain?
2 days, but it's getting worse every hour.
Any other symptoms I should know about? Fever, vomiting?
Does dry heaving count?
Have you experienced these symptoms before, Miss Bennett?
Cassie, I have endometriosis, but this is way worse than normal.
Have you spoken to your OB/GYN about these new symptoms?
Yes, I have, and they can't see me until next week. But the last time I saw her, she just told me to get pregnant. At least then I'd have 9 months of relief.
Right. Well, I've heard that comes with its own set of side effects. Look, the adhesions for endometriosis can cause severe pain. Unfortunately, it's a chronic issue, and there's really not too much we can do for a flare-up here in the emergency department, so...
I know. Look, and I know what you're thinking, okay? Woman with endo comes in, suffering from a flare-up, is afraid it's something worse, and it never is, and there's nothing you can do for her. Look, I have been through this more times than I can count, all right? I've been told to go home and take pain meds and sleep it off, and I have done all that. And
Are you here by yourself?
my boyfriend's out of town. Look, you're just gonna have to trust me on this, okay? I know my body, and this pain is different.
What's your story, Dr. Curtis, quickly?
Emergency walk-in. I'd like to do a lab to isolate the cause of her pain.
Endometriosis. We both know we don't do elective procedures for chronic problems.
Yes, but...
Likely having a flare-up.
I did a transvaginal ultrasound, and...
Nothing's conclusive on it.
there have been cases where imaging has missed ovarian torsion, even a ruptured cyst. Her abdomen's distended, she's in extreme pain, and I am concerned it could be more than endometriosis.
Are you? Or are you fishing for OR time?
No, I want the operative time, but that doesn't mean my patient is wrong about her pain being acute.
Dr. Curtis, endo's tricky. Women can feel one thing one day and something completely different the next. The pathophysiology of uterine nerves.
They're complex.
And often don't correspond to what's happening internally. And every time we go in there, we run the risk of doing more harm than good. Surgical intervention is not an option in the absence of extremely clear evidence, which you simply do not have here. She should follow up with her OB/GYN, send them the ultrasound, otherwise give her Toradol or send her home to rest.
64-year-old female arteriogram.
Aneurysm at 4 centimeters. Let's keep her under observation.
Miss Bennett.
You're sending me home.
Well, your imaging didn't warrant further action, but we will forward it to your OB/GYN for follow-up. In the meantime, I did give you some anti-inflammatories for the pain. So if it gets any worse...
What? Come back? It's already worse. Look, please don't be like the rest of them. Don't do this.
You can take your time getting dressed. What happened?
I got 2 blocks away and threw up. You told me to come back if it got worse. They just gave me this bucket and told me to wait here. I was trying to make it to the bathroom, but I couldn't.
Come on.
I need someone to fight for me.
Yeah. Just, Okay. All right. Let's go. Dr. Singh? Dr. Singh, the endometriosis patient I brought you earlier?
I thought we sent her home.
We did, and she's back in agony. She's vomiting, she's hemorrhaging, which we both know are signs of a ruptured cyst and not just chronic endo pain. She needs surgery now.
Book an OR, stat.
And I want to stay on to see this patient through.
It's your call. If it is ruptured, it's good we caught it when we did.
It was a difficult surgery. In addition to the extensive scarring from the endometriosis, she also had a hemorrhaging ruptured cyst. And as a result of the damage, we had to remove one of your ovaries.
I lost an ovary?
Well, the good news is we got in time to save the other one. You told us that it was more serious all along, and the system's just not good at dealing with chronic pain, so.
You don't know what it's like to be dismissed and ignored, told what you feel isn't real.
Cassie, I just wanted you to hear someone say you were right.
I know I was.